Welcome to Dr. Dean's bonus video titled Buyer's Remorse, Nationalization of U.S. Healthcare Won't Get Us Affordable, Available Medical Care. It is part one of a two-part series. With Democrats claiming the White House and retaining a slim majority in the House of Representatives, what are their plans for health care? Joe Biden has promised to build on the so-called success of the Affordable Care Act with a public option, that is, a federal insurance company. Presumptive Vice President Kamala Harris has voiced her unqualified support for Bernie Sanders' Medicare for All bill. Regardless of what name they use, the public option, socialized medicine, universal health care, single payer, or Medicare for All, Democrats want to nationalize the U.S. healthcare system. Then we would have what might best be called federal health care. Nationalization is defined as the transfer of a major branch of industry or commerce from the private sector to federal ownership and control. Two 20th century examples include FDR's nationalization of the railroads in 1917 during World War I and Venezuela's 1976 nationalization, that is, takeover, of that country's oil industry. Here is a list of the common elements of any nationalization scheme. Let's look at each one to see how it will affect you. There will be a national health budget. Both price controls and wage controls will be imposed. Private insurance will be abolished. The federal bureaucracy will be greatly expanded. And Washington assumes responsibility for your medical care. A national health budget creates what is known as central economic control, the same system used in the Soviet Union. There is no free market. The government, not you, decides the care you receive, when or even if you get it, and by whom. The right to choose is reserved for Washington, not you. Now, can something be both free and very costly? In fact, it can, and it calls to mind the famous TV commercial for automobile oil filters where the announcer repeated over and over, "You can pay me now or you can pay me later." With nationalized health care, you pay nothing now, that is, when you receive the care, and thus you may think it's free. But you pay later in the form of much higher taxes, at least twice what you are paying now. That is how nationalized health care is both free and very, very expensive. Nationalization involves both price controls as well as wage controls. Thus, Washington dictates what it will pay for drugs and how much or how little it will pay providers and hospitals. There is no market competition, and there is no incentive to economize. The private practice of medicine will cease to exist, except possibly on some form of a black market. History has given us numerous examples of the effects of price and wage controls. They produce low quality, they destroy innovation, and shortages of everything, especially care. Can you see yourself waiting in this line for your medical care? Studies show that nationalized health care will lead to death by queuing, where patients die while waiting for technically possible care that is simply not available or comes too late. This has been shown in the USSR, in Great Britain's vaunted National Health Service, and even here in the United States in our own single-payer system, the VA. Section 202 of the Medicare for All bill makes private health insurance illegal. Biden's public option will drive private insurance out of the market by simply lowballing the price of government insurance. Either way, Americans will have only one option for health insurance, whatever government allows. You really need to read H.R. 1384, which is the Medicare for All bill, to appreciate how nationalization of health care will expand the already bloated federal bureaucracy, taking even more healthcare dollars away from care to pay bureaucrats. It also raises the price tag to an inconceivable level, and I mean that literally. The estimated cost of nationalization here is $32.6 to $40 trillion. The entire GDP of planet Earth is only $87 trillion, and Democrats want to spend half of that on a health system that won't provide timely care. Finally, there is the key issue: who is in charge and thus who is responsible? Democrats say that we are entitled to care and the government will provide that care. Now, ignoring the fact that their promises just never happen, consider that nationalization puts Washington in charge and makes some faceless bureaucrat responsible for your care. For you and me, there is no personal responsibility, and therefore we have no right to choose. In 2009, 5 years before Obamacare was implemented, author Daniel Putowski wrote a fictional account of what nationalization, federal health care, would look like for an average American. His novel was titled Universal Coverage, which is actually the title that was later used for Section 102 of the Medicare for All bill. In the book, the protagonist started out fully believing government assurances that people would get all the care they needed when they needed it. When his son was found to have a life-threatening heart condition, universal coverage consistently failed to provide the necessary care. Eventually, a desperate father had to resort to black market medical care in order to save his child. If health care is nationalized, Americans will soon discover that what Putowski wrote as fiction has become our terrifying fact. There is a way out of the impending nationalization nightmare. In the next video, part 2, we will explore how Americans can get the care they need at a price they can afford without dying waiting in line for Washington's so-called free health care. For more on this, for all the details, you can read Curing the Cancer in U.S. Healthcare, States Care, and Market-Based Medicine. And do check out the wonderful audio version of this book. If you have not already subscribed to the website We Can Fix Healthcare, check it out at deanwaldman.com. That's Dean with an E. My mother did that to me 77 years ago. Just click on the blinking icon on the top right of the banner. There is no charge for any of the bonus materials. Also, encourage your friends and neighbors to subscribe, and finally, be sure to subscribe to my YouTube channel to view the latest videos. Just click on my image to your right on the screen. Thank you for watching and for being part of the cure for our sick healthcare system.